Well, welcome to the podcast. My name is Father Bill W. I am an Episcopal priest living here in Austin, Texas, and I'm in long-term recovery from alcoholism and any number of other addictions that have come along on my path. I want to welcome you to the series. We're doing a series on Carl Jung and see if Jung's an understanding of Jung can help us go a little bit deeper into the 12 steps. He certainly played an influential role in getting Wilson into the program, if you study the history. But now to go back and go a little deeper into Jung and what that can help us with. So my guest is Dr. Ian McCabe. He lives in Dublin, Ireland, as you will soon detect from from his accent. He's not a native Texan, I can tell you that. Wrote a book called Carl Jung and Alcoholics Anonymous, The 12 Steps as a Spiritual Journey of Individuation. And so we are going through it carefully, slowly, thoughtfully, and trying to glean from it what we can that would help each of us who's on a spiritual journey. So welcome, Ian. It's good to have you back, and I'm looking forward to this episode. In this particular episode, I'd like to begin exploring steps 2 and 3. But we probably need to begin with step 1. It's very dangerous, I've found, to just don't jump into a particular step if you don't have the foundation. And the foundation of step 1 really runs throughout each and every one of these steps, eh? So insanity, the step 2, talks about being restored to sanity. I did take a course in logic in college. And if you're going to be restored to sanity, it presupposes you were insane at one time. So what's the insanity in step 1? Can you help us understand that and take us a little deeper into that?
Insanity comes in step 2, restores us to sanity, came to believe that a power greater than ourselves could restore us to sanity. But I think the insanity has been in the acting out by the person with an alcohol problem for many, many years. Their behavior has been insane in the sense that they will repeat the same process of going to the bar, thinking they will only have 1 or 2 drinks, and end up spending the whole night there. And this is a common definition of insanity, repeating the same thing and hoping it will change. But I would like to just get back to step 1 from a Jungian perspective and say it is the most powerful step that one can imagine, because the person is admitting that they have a problem with alcohol, that they're powerless over it, and that their lives are unmanageable. But the first part of it, admitting the powerlessness, from a Jungian perspective, this is a deflation of the ego which has been built up with the help of alcohol, that it's almost like King God. And now it's admitting that it can't manage its own life. And the ego is the executive director of consciousness. It's what helps us to function in the world. But now it's admitting, hey, what's happening is just beyond my capacity. I'm making a mess of things. It's unmanageable. I'm going to hand my life and my will over to a higher power. So admitted we were powerless over alcohol, that our lives become unmanageable. So then there is this deflation of the ego. It's very similar in Jungian therapy, that a person's life is becoming unmanageable in some way, and they decide to cross the threshold of the therapist's office, to seek help, to hand themselves over to a higher power. And the difference being that Neither of them know that the long-term objective of AA, for example, is the 12th step, to encourage the person to have, by working the steps, to have a spiritual awakening. And similarly in individuation, the analyst doesn't say, come in, I'm going to help you to individuate. They
Right.
just want to get rid of their neurosis. But Carl Jung says, curing the neurosis is not what I'm about. It's about what he called the numinous, the spiritual. So in both instances, there's a parallel there that they don't know the long-term plan. And when we say working the steps, I would say that that is just meaning that one begins to follow almost immediately the four absolutes, that one becomes very honest and unselfish and pure in thought. And let me see, what is the fourth one? I always forget the fourth one.
Loving.
Loving. Yes. And so these are put into practice, and this really is working the 12 steps. And so that leads us to the second step, where we hope that a power greater than ourselves will restore us to sanity. Yes, I think the acting out with the alcohol is insane, but it's a bit like pouring oil on a fire. So you have an inferno, but when you take away the oil, you just have the embers. There's always a little bit of insanity there, but I don't think the word insanity remains with the person in sobriety. And you can say, well, where does this insanity come from? And I would think it comes from trauma, post-traumatic stress disorder. Also, it could come from inheritance in the genetic factor of people. But however, not a big deal, because we're going to be restored to sanity is what this step promises. And we could look at insanity through a Jungian lens, certainly. The ego is the center of consciousness. And it's responsible for guiding the human being through their lives. But if it's making all these bad decisions, you could say, oh, that's insane. It's no longer sound of mind. And we have this terminology, you're not of sound mind. So when the person is drinking, obviously they get drunk. And I would say, yes, they're not of sound mind. So there is also, you could say.
But let me interrupt. There's also see, the way I understand the insanity is it's not the action. For me, it's not the action. It's the thought that leads me back to taking the drink in the first place. And when I do that, I am perhaps not under the physical influence of alcohol, but I am experiencing what you're talking about, stuck in the ego thinking that it can handle this. And that's the insanity. That over and over and over again, I go back to the very thing that's killing me. So very important to distinguish the physical aspect of the illness and then the mental, psychological, and as you say, where the ego takes on godlike proportions. You know, I think that's exactly right. You know, we don't say it. You say I'm God, they lock you up. But if you think that way, you're a good American.
Yeah, and there's also the aspect of the word addiction, and it's addiction to alcohol, although we associate so-called drugs, but alcohol is a drug. And I looked up the definition in the Oxford Dictionary, it's a couple of pages long, and it comes from the word adhikari, which means enslavement. That you're sold into enslavement, but also looking at the word addiction, addiction. It's as though something is on my shoulder dictating to me. It's added on.
Yes, yes.
So, and terrible thing is, the person is paying to be enslaved. Normally, a slave doesn't pay to be enslaved. They might even receive some money upon their release. But no, they're paying to be enslaved, they're paying to feel sick and tired, they're paying to make a mess of their lives. So of course, this addiction from a
Mm.
outside perspective, objective perspective, is insane behavior, unsound behavior, mad behavior. And people know it. They say, he's not in Ireland, they say he's not the full shilling, not the full shilling.
I had a sponsor who said to me, you know, what is the most insane thing an alcoholic could do? Well, pick up the drink. Well, what's the most normal thing for an alcoholic to do? Well, pick up the drink. So there's something going on in the very deep recesses of our minds, maybe our souls, that needs transformation. It's in, yeah.
And I think there are 2 points. There's 2 points on this. First of all, the ego is the executive function. That means it does the picking up of the drink.
Right.
And it's, as Carl Jung would agree, I would hope, and Bill Wilson would agree, it's a spiritual illness. So in doing that, it's ignoring the true self, the higher
Right.
self, God
Right.
within. So that creates a dis-ease, a
Yes.
non-ease. So that in itself will be a neurosis and will be looked
Right.
upon as being insane.
Right.
So there is that factor, but I do also believe from the physiological perspective that once the alcohol gets into the primitive brain, the
Right.
primitive brain believes, because it causes such pleasure, it needs this not just to give pleasure, but to survive. So it's a survival instinct, and it's sending a wrong signal to the cortex, which is just recently developed in human beings, like maybe a million years or 100,000. But before that, we had the primitive brain. And once the primitive brain got any food,
Right.
any nourishment, anything that made it feel contented, it wanted more of that in order to survive. So I think there's a mixture between the primitive brain and the...
Absolutely. I think it's in your book. It's pretty common, you know, the man takes the drink, then the drink takes the drink, and then the drink takes the man.
Right.
So the drink taking the drink is what you're talking about with the primitive brain. But see, if I've got a couple of years sobriety under my belt, or at least dry time, and then the insane thought comes back, well, maybe not so bad this time. See, that to me, that's the insanity that I was taught you're going to have to live with. And every once in a while, Bill, it's going to come up in your crazy head. You know, you're insane, but it's a very particular kind of insanity. You know, we're not going to lock you up, but you better watch out, because this madness will resurface from time to time. That's been my experience.
Absolutely. I think people with alcohol problems are aware that they have this insanity, but the good thing is no one will know, provided that
you don't have to put a big eye on your forehead, eh?
most people have got too much to worry about someone who's not drinking. But
Right.
the worst thing about this illness is that it is doing press-ups in the unconscious. It's doing press-ups. It's trying to build itself up to be stronger. So that's the reason why people go to meetings, to combat the alcoholic urge, craving to drink that may reoccur. Now, the worst thing that happens is dreadful. It happens with people on heroin as well, that when a person who has been sober for 10 years decides to take a drink, it's not as though they're back 10 years previously. Right. It's as though they have been drinking for 10 years. And this is very difficult to get your head around. But the illness must be physiological in some way, because it's developing all the time. So when a person has a drink after 10 years, it's as though they've been drinking for that 10 years. So their capacity is going to be extended, and it's going to hit them harder, because at least when they were drinking year 1, year 2, there was a gradual build up to it. But now suddenly after 10 years, boom, gone. And this applies tragically to people with heroin addiction. They get out of prison and they take an amount of heroin that would have been normal before they went into prison. But now, because their bodies are not used to it, they've detoxed, it literally kills them.
Yeah.
It's too much.
And they're
to handle.
lacing it with fentanyl and other things as well.
Even,
you don't even know what the hell you're taking.
Even without that, it's the overdose.
Even without it.
It's an overdose because at one time they
Right.
would have taken it in their stride, but
Yes.
because it's been detoxed, it's now amounting to an overdose.
Well, and in the course of alcoholism, there is an increase in tolerance, but
Yes.
later on there comes a decrease in tolerance.
Right. Yes. Yes.
So a similar effect, would you say?
I would think so. And one might not know where one is on this graph.
Right.
So 10 years later, one could be on needing more drink to get the same effect or less drink, but their capacity to drink will be more. So people find their drinks after 10 years are, nightmare experiences, I'm told.
After 10 years sobriety, you mean? Or yes,
Several
yes,
years,
yeah.
several years
Yeah.
sobriety, people drink
Yeah.
again. It's just a nightmare for them.
Right.
And it can be
So-
even more difficult to get back into a not just because of the shame factor, because the primitive brain has been activated and is now back in control.
And the delusion is there that I think I know this stuff.
Yeah.
I don't need this basic stuff, I'm an advanced student. And it's very difficult to come back. So in step 2, we got the insanity. We started with the back end of the step, and I think that's very important to do that.
Mhm.
To be restored to sanity is what this goal is. But it's in the beginning of the step. It says, came to believe that a power greater than self, than ourselves, is capable of doing this. Now, Jung was a scientist, and he believed in the power of spirit, obviously, and in the need to connect oneself to that. And we'll get into that more deeply. But I think it's important to say that he didn't approach it from a theological perspective. Who is this God? If we're going to use the G word in step 3, we kind of sneak it in 2.
Mhm.
We're looking for a power greater than self. And there's a quote that I love. It's not in your book, but it is from Jung. And God, I've read it 20, 30 times, and it just means a great deal to me. So here's what he says. He says, I am not addressing myself to the happy possessors of faith, but to those many people for whom the light has gone out, the mystery has faded, and God is dead. So he says, listen, guys, and I think AA and any 12-step program would say the same thing. Listen, you may not be a believer. That's quite okay. Quite okay. We're not necessarily addressing that to you, but we are asking you to have an open mind. So he says, for most of them, there is no going back, and one doesn't know either whether going back is the better way. To gain an understanding of religious matters, probably all that has left us today is the psychological approach. That is why I take these thought forms. We'll look at that have become historically fixed, try to melt them down again and pour them into molds of immediate experience. So he was raised in the Judeo-Christian tradition, and so those were the thought forms. Death of the self. Well, how do you put that in a language that people can understand? Crucifixion. What does that mean? Because the ego is going to feel like it's being crucified as I go through this process. So his thing is, let's take these thought forms that are there, melt them down, put them into new language so that people can experience them and get the the juice that used to come from religion, but has dried up. You know, I think that's where he's coming from. He took the sacred very seriously. Is that not right?
Absolutely, absolutely. And he himself, when he's encouraging Roland Hazard, sure, he doesn't say specifically get in touch with God. He mentions very vaguely people who've had experiences, and he lays out a few clues for him, because he has to avoid being a scientist actually stipulating a religious conversion, simply because he had Freud on his back at this time very heavily, and other scientists who would criticize him very heavily if he publicized his view that alcoholism was a spiritual illness. So in his letter to Bill W., he does say, "Oh, I trust you. I will let you know." Now, I think he was very much aware that people who had lost their way, so to speak, that he said that if you wanted to find true spirituality, go to the basements, go to the doss houses, go to the places where the less worthy are trying to get better. And he, without referring to alcoholics, he was really referring to people who had mental struggles and who were trying desperately to find out what was wrong with themselves. So of course, it was easier for him to look on the ego and the true self as explanations, as scientific explanations, rather than to delve into religion too much. But he wasn't a religious person himself. The church that was in his immediate neighborhood,
right,
in Zurich, he only went into it once, and I think that was upon the death of his wife. But other than that, he never attended a conventional church. But when asked, does God exist? He said, I know God exists.
Through experience.
Bidden or unbidden, he said, God is here.
Say that again.
He had a plaque over his house, and it said, bidden or unbidden, God is here. God is present.
Invited or not invited.
Yes.
Realized or not realized.
Yes.
Yeah, that's right.
He had to adopt a scientific approach in order to retain his credibility, because remember, he was always considered far out. He's still considered far out by many conventional psychologists and psychiatrists. Even then, in the 20s and 30s, he was very careful, and maybe that's why he was very interested in alchemy, because he could see that the person in addiction and alcoholism had to be brought down to the bare stone before they could be rebuilt. And so the process of alchemy involves burning the stone down to its primal material, and then blending it in order to make gold out of it. In other words, to get the human being to strip them of their ego delusions, and then to build them up and make them strong again. And I would just say there's slight confusion about the ego when we say inflated ego or deflated ego. The ego can be strengthened, and then it knows its place with the true self. So it can form a partnership again with the true self. And that brings it back into a peaceful mode within themselves. So the unease and the dis-ease is gone once the ego is strengthened, and it becomes self-confident enough to know it can now function in the world. And this is what happens, I believe, with the working the steps of Alcoholics Anonymous, that the person no longer has this huge inferiority complex that's compensated by an inflated ego, that their inferiority complex is reduced and their ego is strengthened.
And that's very, very important, because it's not that I become a nothing. It's that I become who I was really meant to be. And that's very important. If I'm in a relationship with a sponsor or a program that's tearing me down to absolute nothingness, no, be careful of that. It's tearing me down to the gold that's inside of me. And
Correct.
if the person who's doing the tearing is not aware of the inner gold, it can be very destructive. Sometimes I guess you would get a patient who before you would, now there is a need for that process to reduce the size of the ego, the inflatedness of the ego, and that happens. But sometimes you'll get a patient who needs to have that ego built up at first. You can't begin with the chipping away. You first have to build it up.
Yes, and sometimes I hear clients, I refer to my clients as clients, simply take away the medical model, and they would say things like they asked someone to be their sponsor, and the sponsor immediately gave them tasks to do that were unreasonable. And in particular, they would be telling them not to speak at meetings, to put a plug in their mouth and
Right.
take the plug out of their ears. And it seems very, very harsh. Now, hopefully it's not all sponsors do that, but you can see that some sponsors who might themselves have not attuned their own inflated ego now find having a compliant, willing person who is willing to turn his will in his life over to the care of a higher power and thinks the sponsor might well be that, and the sponsor there that. So there's a danger of that.
Also a danger of having an unhealthy therapist who could do exactly that, or an unhealthy clergy person who can do that. Yep. So these positions of authority are there's some accountability that really needs to go along with that.
Absolutely. Well, at least with professional therapists, they have a code of practice and an organization that people can complain to. But yes, I think the temptation for someone who hasn't been instructed in relation to their boundaries and the power complex, it could be slightly dangerous and damaging to the person. Most damaging that the person might consider that the sponsor is representative of AA and leave AA. That's the danger.
Yes.
But overall, the reports I get in is the sponsorship is very good, and it does act as though the person is a therapist. So it's like free therapy. Better, because sometimes they can ring their sponsors at 2 o'clock in the morning.
Well, I'm going to label this episode Divine Therapy, in search of divine therapy, because ultimately that's where it's leading to a relationship, as you're saying, with the true self, with the higher power, with the self with a capital S, as Jung would refer to it, that is healing. It's healing for the ego to find that relationship and then to live out that relationship. I mean, that's what it's about.
I think this happens in Jungian therapy through the person beginning to listen to their unconscious through dreams and various techniques like writing, and then is guided by the unconscious. That the unconscious in this case could also be called the higher self, the greater self, the higher power.
Right.
And
there's a quote. This one is in your book. He says, among all my patients in the second half of life, there has not been one whose problem in the last resort was not that of finding a religious outlook on life. And we might insert spiritual there, a spiritual outlook, a connection. It's safe to say that every one of them fell ill because of having lost that which the living religions of every age have given to their followers, and none of them has been really healed who did not regain a religious outlook. So comment on that, if you will.
I think physiologically within ourselves, we have a yearning for this higher power, as first described by William James. I love to see it in the form of a plant. If you turn a plant around on your windowsill, it will turn around and look for the sun.
Right.
We ourselves are looking for the sun. And the sun being the higher power, the unconscious, the greater self, God, whatever name we want to give to it, is that we want to become connected to it. And so
the big book, before you go on, talks about the sunlight of the spirit.
Sunlight, beautiful.
Yes.
And the comparison between Jungian therapy, where you're getting the conscious is getting in touch with the unconscious, and to be guided by it, in the 12 steps, eventually it comes about, and it says in the promises, we will intuitively know how to handle situations that used to baffle us. I believe this is because the person who is working the 12 steps becomes in contact with their higher power, with the God within, with the greater self, and is guided by this knowledge that dates back 5 million years at least, because as human beings, that's how long we can trace maybe our beings back to. And so the intuition is the unconscious guiding the conscious. And in Jungian terminologies, it's the individuation process, where again, the unconscious is listened to by the conscious, and there's a nice relationship where the conscious is guided by the unconscious. In other words, the ego, being the conscious, listens to the higher self, and on the relationship, it's comfortable, it's easy, it's not uneasy, it's not disease. And that's what both Jungian individuation and the 12 steps are looking for, is this unity, this spiritual awakening in the 12 steps, and in the Jungian concept, the individuation process. Neither are going to go around shouting, hey, I'm individuated, or hey, I'm spiritually awake, but it happens. And sometimes we know a person who has attained a state of individuation or a spiritual awakening.
Yeah, so there's a connectedness with the sacred, with the divine, and I hear you saying that we are meant for, but have lost, and so we must go in search of that. And if you are an alcoholic or an addict, you have a driving need to go and find that. I had an early sponsor who used to say, you know, we have a gift, you know, while normal people just kind of rust out, we burn out. And so we have this anvil hanging over our head that says, Bill, you will get spiritual. You will find this connection or you will die. And that can be a very driving and powerful and effective force in motivating us, you see. Maybe that's why we always have to go back to step one, like we did at the beginning of this episode, you know? Because if you miss that, you're onto an intellectual game of some sort. Is there a God? Is there not a God? Well, if you're dying, you hope to hell there is a God because you've lost any ability on your own power to do, you know, to help yourself.
Yep.
So,
and it does seem a little bit unfair that, you know, a person who has a predisposition to becoming an alcoholic, because their father, for example, was an alcoholic, and then they suffer some trauma, which is not unusual. And then it makes this journey of reconnecting with the spirit so lengthy and so awkward and so difficult. But hopefully the higher power will appreciate that a difficult journey has been made to reconnect with the higher power. But certainly Jung, when he mentions that true spirituality can be found in the basements and the doss houses, with people struggling, rather than people, maybe I'm not criticizing anybody who just comfortably goes from their early communion to this and never bothers to worry about it too much. But I think the person with an alcohol problem has struggled very gravely to get in contact with their higher power, and hopefully it will be of immense benefit to them.
Absolutely, absolutely. Now, there are many paths. AA says this itself, that this is only one way among many. Now, I found it's the one that works best for most, is the addition I would put to that. But for Jung, he had a belief in the power of the church, for example. We started getting into this, to affect this transformation if it's done properly. So here's a quote. It's in your book. This is Jung. My attitude to these matters is that as long as a patient is really a member of a church, he ought to be serious. He ought to really and sincerely be a member of that church, and he should not go to a doctor to get his conflicts settled, where he believes that he should do it with God. For instance, when a member of the Oxford group comes to me in order to get treatment, I say, "You are a member of the Oxford group. So long as you are there, you go settle your affair with the Oxford group. I can't do it better than Jesus." He had a sense of humor, I suspect, eh?
Yes, yes. And I would speculate on this, that this is actually a reference to Roland Hazard's second visit. So he's told Roland Hazard in 1926 to get a spiritual connection, and Roland Hazard joins the Oxford group and is doing quite well, but at some stage has a slip. So he comes back to Carl Jung. But the truth is, as a clinician, if someone comes back to me and says, I had a slip, it's a bit like they've broken their leg. I go, okay, where'd you break your leg? Okay, you broke it on that step. Well, you're going to be careful now when you're walking down that, and you're going to wear special shoes. And I can't do any more than that. I say, that's it. So similarly, with someone comes back, they've had a slip, I might say, okay, what was going on before that? It's called the antecedent behavioral analysis. And you go back and you say, okay, so you had an argument with somebody and you felt hungry, angry, lonely, or tired. And can we avoid that in the future? In other words, there's not a lot more Carl Jung could have actually done for Roland Hazard. Got him sober for several years by joining the Oxford group. Now, I'm speculating that it was Roland Hazard, because in this instance, Carl Jung says it's an American businessman who was a member of the Oxford group who comes to him. Now, there were not that many American businessmen who were members of the Oxford group going to see Carl Jung in Zurich. So it's a speculation on my part, and it's a research I'm still trying to clarify by contacting various hotels in Zurich around the early 30s. But I think he's really saying once a person is following the Oxford group and following their four principles, which form the basis of most of the 12 steps, then they're following them thoroughly, then there's not much more clinicians can do. For example, I have a friend who's a pediatrician, and she told me she spoke to 12 doctors in a group over lunch and said, have you ever got an alcoholic recovered? So I just said, no, never. And I'll extend that a little bit further. Around about 1934, the American Medical Association wrote to doctors saying, listen, stop treating alcoholics. You're not going to cure them. It's moral torpitude. It's their own fault. And I suspect they were thinking the medical profession is getting a bad name because it's not able to cure these guys, and you just leave them alone. And the wonderful point is that this was in the mid-30s, just when AA was emerging. So it came to compensate for the lack of medical ability, psychiatric ability to heal the alcoholic. And I would definitely say, in my experience, yeah, try whatever you want to try, but put Alcoholics Anonymous down at the top of your list.
Yeah, like I said, it's the one that works the best for most, but it may not be the one that works the best for all.
Correct.
And Wilson said that, that we have to be careful on this thing. Now, in Ireland,
Follow through on that and just say a little bit controversially, I think Bill was a great advocate of using LSD to deflate the ego. And nowadays they're coming round to using psychedelics to help a person to get in touch with their higher power, with their true self. And I would be a strong advocate of a person who's atheist and will not under any circumstances go into AA, to encourage them to take ayahuasca or LSD under medical supervision so they can get in touch with their higher power, because the experience from what I'm hearing from clients and people who've taken it is absolutely wonderful. So that would be a controversial point of view, but sorry, I interrupted you, Bill. You were going to talk about Ireland?
Yes, yeah. Well, we'll follow through on that. I mean, there's some research, and Wilson, of course, was interested in his later life
And took
in
LSD.
having alcoholics have the kind of experience that he had. Okay. Now there is some danger in that and misuse of that, and it is very controversial. And we might get into that in a later episode at some length, because I think it's important. And there is a lot of research. And one of the things you say in your book, I believe, is that the research stopped.
Yes.
And that's not a good thing. I later in sobriety, I went to sweat lodges, which were very. I mean, I certainly wasn't raised in a sweat lodge. It was foreign, but there was a change in consciousness. That participation in that ceremony affected in me. That was very, very helpful. And vision quests and things of that nature that bring one in contact with the divine in some ways. And these things are really, really important. Now, prayer and meditation can have this effect on an individual if it's done seriously. Fasting can have an effect on consciousness. Many of the practices that went along with traditional religion that we've lost. Yes. You see, I mean, they're not practiced. Yes. And now there's a tendency to go back and revisit these, and see what is the element that was there. And can we, and I think this is what Jung was saying, can we take these things and bring them into the modern day in a manner that doesn't offend our sensibilities, about reality, but maybe can expand when the big book says the great reality is within. What the heck does that mean? It doesn't mean God's sitting on my liver. It means that there's a consciousness here that we have lost and that we really need to reconnect with.
Right.
And there are different ways to do it.
I just add that Carl Jung himself was against the use of what he would call short-term means to get in touch with the unconscious, such as LSD. He would have much preferred that people would use dream analysis and mental imagery and creating
active imagination. Yes,
exactly. And but my argument would be that maybe it's not available to everybody, and that for a person who's chosen death rather than sobriety, then this last ditch attempt at using a psychedelic can be very helpful. But as I say, my viewpoint is quite controversial.
Yeah. Well, so was Bill Wilson's. They wanted to throw him out of AA, I think, for that, and hide the fact that he did it. But he was interested in vitamin B therapy, B12, I guess it was, and LSD. What are some things that can trigger the internal connection with the divine? What are these things? And put an end to the dis-ease. Yeah. So
also, he did work with two psychiatrists in Canada, and their research was very, very sound. That they treated thousands of people who were psychotic with alcohol problems.
Yeah.
And success rate was 75%. And as Bill himself wrote, you know, if they're having a success rate of 75% of getting people off alcohol, and AA is having a success rate of maybe 8 to 10%, maybe we should at least...
Yes. Don Lattin, Lattin, wrote an interesting book on this. I'll put it in the show notes if you're interested in kind of following it. So let's turn now to step 3. We've looked a little bit, and gosh, you can go on forever on step 2. There's great depth there. But turning to step 3, made a decision to turn our will and our lives over to the care of God as we understood him. You say in your book, this step introduces a person to their true self. So, one of the things I learned from my own research when I was 20 years sober, I started digging into the history, was that this was a one-time ritual, in effect, that one did with one's sponsor, spiritual advisor, whoever it might be, that they did a ritual act. Give your life to God. Say it. Put it in your own words, and then let's get on with the rest of the program. I was trying to, get it done perfectly. The guy who did the Oxford group introduced me to that history. He said, have you done step 3? I said, well, I do it every day. He said, no, not every day. You do it once. You do it once, and then you move on. But you do it powerfully, impactfully. And I did it with him. I'm 20 years sober. I'm on his living room floor. He says, get on your knees and give your life to God.
Yeah, and even Bill advised that get on your knees and pray. And he said, God, I offer myself to thee to build with me and do with me as thou wilt. I mean, this really is turning our will and our lives over to the care of God. But on the ego self axis, you can see that people pull back from this and say, oh, well, I will do this and forget. And so there's a toing and froing all the time. But I like it even in the Bible. It says, take this cup, very indicative, away from me, not my will, but yours be done. So there is definitely, and I think it's what Bill did when he was in Towns Hospital, where he had a revelation that, as from memory, that if there be a God, let him show himself.
Yes, but correct me if I'm wrong on this, that Jungians often believe in the power of ritual, the power of ceremony, that the unconscious at some level resonates with that. Yeah, talk about that. Could you help us with that?
Absolutely. Jungians are very big into ritual. It could be starting with adolescence and the rituals that are needed to leave home, the passages. So they're very understanding that passages and rites of passage and acknowledgement of rites of passage are very important for our consciousness to develop. So they're very respectful of all the rites of passages. And for example, in very, what we might call primitive tribes, they have wonderful ceremonies that, we go back and look on and go, oh, they're primitive dances, and particularly the adoration of the sun, which we just talked about, the sunlight. I mean, that could be a very primitive belief that the sun is God. But the wonderful thing is that I think there's a Native American tradition where they believe they help the sun to rise each day and settle. And I love that they feel connected with the earth to such an extent. And that's a connection with the higher power, with God, that we're part of the God and helping the God in some way by helping ourselves. Yeah.
And that's a major piece that is missing today, that traditionally religions provided. That's why that quote is so important to me, that for many the light has gone out, that we have to reconnect in some modern way with the things that these ceremonies gave to us. And again, paying attention to our dreams, using our visionary qualities of our life, trusting in our intuition, getting in touch with that level rather than just the rational, the cold rationality that has no appeal or loses its appeal. And that's one of the things I think alcoholics want to go back to. Well, at least I felt something there, and I'm in search of that something. Can't you help me get in touch with that? And to me, Jung helps one get in touch with that.
And Jung actually says that alcohol is a sort of a low grade form of spirituality, because people can feel spiritual. I'd equate it to art today. Some people say the only art that people get is the advertisements on television, because they are so artistically done in order to captivate people and captivate their money. But isn't it a great tragedy that the only art that people might see is the adverts on television? Obviously, there's more around, but that it would be one of the main arts. So similarly with the rituals, particularly fatherhood, and the neglect of the transition into adulthood. And there are rituals that are brought by young people themselves, and it can be drug taking, for example, a member of a gang and stuff like this. So ideally, it's up to the elders as to bring the younger people into the outer world by separating them from the parent, in particular the mother, and allowing them to become men. And yeah, these are rituals that we have lost.
Right. Yeah. I did a 5-day session with Richard Rohr in the mountains of New Mexico many years ago, rites of passage. And it was very powerful. It was all about ceremony and ritual and entering into that at a deep psychological level. And you felt it. I mean, it was so impactful.
And it is, and entering into it, and the third step of turning our will and our lives over to the care of God is not that we're annihilating the ego. We're certainly deflating it, but we're strengthening it in the long term. It's becoming stronger, and but it will realize that maybe it's no longer the master, but will act more in the service of the self. So people who organize rituals, for example, who I've spoken to, they do seem to have this understanding that they're acting in the service of a higher power and passing on the knowledge. Maybe what priests did in other times.
Right. That's right. I mean, that's the role of the Jungian archetypes. The king energy, the magician or the priest might be the role of the magician, the lover, and what's the fourth? Well, we'll think of it. But these energies, these powers that exist and that we need to connect with, but connect with properly.
Yeah.
Yeah, humbly.
Interestingly, I've heard Jungians ask, are we really pastors? Are we really religious, spiritual guides?
Right.
Not just clinical psychoanalysts, but there is a spiritual component to our work. There cannot help but be a spiritual component to it, because we're dealing with the unconscious. And the unconscious is where arguably God lives or stays or is.
Yeah. It's been my experience, and I suspect yours as well. And there's great depth to it that never ends. And that's the beauty of this thing, the spiritual journey that we're being invited. See, for step 3, it's the beginning of that quest. I look on it now as a spiritual quest. Okay, you can't do it. Maybe there's something that can. Now, will you connect with that something? You don't have to understand it. You never will. but you can be in relationship with it. You can enter, and that's what you're describing here, entering into that relationship. And there's energy there. There's power there. There's juice there, that I was losing at 20 years. If it's just, go back to more meetings, more meetings, more meetings. No, get into the depth and the essence of what these steps are meant to bring us to, which is right relationship with the numinosum, the divine, call it what you will. But that's what we're looking for. And you're not going to find it in a bottle, and you're not going to find it in more food or more sex. You may find it for a little while, but you'll be worse off after it loses its power, which doesn't last very long,
It's wonderful that people do have awakenings. And, I think it's step 12. It says, having had a spiritual awakening as a result of working these steps, that it does happen. So
yeah,
meetings may be monotonous. Something seems to wear off on people, that if they do go to the meetings, but in particular, if they work the steps, if they take the action, particularly in relation to step 4, writing down their confessions, and actually confessing, this is the process by which a person does awaken.
That's right. And that's, I'm going to call that steps 4 through 9. Is kind of the great cleanup. Yes. All right. We're now entered into a relationship with this higher self. What do we need to clean up in our lives to make that relationship right and more powerful? And that's what we're going to get into in our next episode. So steps 4 through 9, deepening, clearing what we can in our distorted ego life, so that the ego can rightly relate to the higher power. All right. So you're willing to come back next week and guide us through that one, Ian?
Maybe even look at the alchemical process that's involved in burning away.
My God, we're going to go to that. Hey, okay.
Thank you, Bill.
Thank you very much. And thank you guys for joining us. I hope this was helpful. Ian, you've been a wonderful guide to taking us deeper and deeper into a Jungian perspective on the steps. So thanks so much for joining us. God bless, and keep coming back, guys.